Hi, I'm Jackie. This is Morgan, and today we are gonna go over how to do a pig dressing change. So I just got to the patient's home. I already did my hand washing, and I got everything set up. So now I'm gonna use hand sanitizer for my hand, and then I'm gonna glove up. Okay, I'm gonna let my hand dry out for a bit, so the gloves go on a lot easier. Okay. All right. So now I'm gonna open up my kit. We already have masks on. A kit does come on with masks, so you can save that for later use. I'm gonna get the glove off to the side in a clean area, the ruler, get it out to the side, and then I'm gonna go for the sterile dental bib and put it under my patient's arm. Alright, okay, so place it there nicely. And also, you could kind of like go outward and put it more flat, so it'll be easier to do the dressing change. So that way it reduces risk of the PICC line getting pulled out. Okay, so now we're gonna go ahead and remove the PICC dressing.
Morgan doesn't have an actual pick line, so we're improvising.
Yeah, it is taped in. So where the bile patch is, that's where the PICC should be inserted into. That's where the insertion site will be. So I'm gonna start off with removing the bottom side of the PICC dressing. And if it's pretty stuck on your will, you could use adhesive tape remover or alcohol to help remove it. Alright, so you always want to remove it from bottom up. Never go from this side because that will pull out the line with it. So always make sure to pull it down up. Alright. And the bile patch should be aligned with the PICC line so it will pull off with the dressing. Alright, so that tape wouldn't normally be there. This is just to hold the line onto Morgan's arm. But this is where the insertion site should be. Okay, so now we're gonna take off the wings off the stat lock. Okay, so we unclamped it on both ends, and we're gonna gently lift it up and move it to the side, being careful not to let the PICC line get pulled out. So I hold it in place there, and then you could secure the PICC line, and with the other hand peel off the stat lock device. Okay. All right. Okay, so we got that off. So now we're gonna place it there. Are you able to like go a bit more flat, like okay, there? Yeah. Okay, so now I'll make sure it's nice and secure in place. Okay, so now that that's done, we're gonna remove our gloves. We are going to sanitize our hand. All right. Now we're gonna put on our sterile gloves. Alright, we're gonna grab our chloro prep. So squeeze it. And then with our other hand, we are going to use grab a gauze, so that way we will keep this hand sterile while we touch the PICC line. Okay. Alright. So now we're gonna clean it well for a good 30 seconds. Okay, make sure you cover a good amount of area, and also like to do the bottom part as well. Okay, so turn it under. Okay. All right, so now that we got it clean, we are gonna let it dry for a minimum of 2 minutes. And in the meantime, we'll discard the ChloraPrep.
Two minutes have lapsed.
Okay, 2 minutes has lapsed. All right. So now we're gonna go ahead and secure the line with the stat lock device. Okay, so another tip is to always make sure that the flaps on the bottom side is on the correct side. Make sure one side is not overlapping to the other, because then you'll have a hard time finding that flap to pull it out. So make sure they're both on the side that it's supposed to be. Okay, so now we're going to gently lift it up and slide it over the stat lock device, making sure the flap stays in place. Okay, so... Alright, so slide it into the hole, okay. Then we're gonna shut the doors on it first. That one came a little bit loose. Okay, give me a second. Alright, now that it's in, we're gonna close it. And then you wanna secure it. Try to reposition it slightly so it's not constantly staying in the same place, and you wanna minimize skin breakdown. So once you find the spot, usually they like it facing outwards rather than downwards, so it's not going to be close to their crease. So we'll secure it right here. Pull that side, pull that side. Okay, now we got that done. We're gonna get the bile patch. Okay, so we'll do this side up. We'll say on the bile patch which side goes up. We'll put it here if we want to make sure it's aligned correctly with the line. Never put it under this way, because otherwise it will tug on the line when you pull off the dressing. So make sure it's aligned correctly, just like that. And then we are gonna get the Tegaderm dressing. And if the patient's sensitive, you may want to consider using an IV 3000 dressing. Okay, so we are gonna wanna put the dressing on this way. This way? Alright, so get it nice and secure, press on it nicely, make sure it sticks. Okay, we're gonna do this. Take this side off. And then for the bottom piece, we're gonna be careful with it. And you can always have the patient grab it for you to, if you wanna, can you hold this for me? And just hold both lines for me.
This part?
Yeah, both of them. Just keep it up for me. Okay, you can let go now. Okay, that didn't go as planned. Okay. I can fix it. Don't worry, we're good. All right. Okay, so we got the dressing kit done, and also you want to date it. Just put the date on there and your initial, and put it on the dressing. We are gonna measure it next with the ruler, starting on the making sure you go on top of the bile patch. So in this case, it is 30 centimeters, and you could rip it to remind yourself where you measured it at. Okay. All right. So next.
How far was the cath out?
Also, you want to make sure you record how many centimeters it was out. In this case, it was 0 centimeters out. The first dot is going to be 0, and you will see it closely. You look closely, it's going to be 0 centimeters. Each dot after that is another centimeter. So in this
A lot
case,
of times I'll date initial and put how many centimeters the catheter is out on there
okay, yeah,
for the next nurse.
that's one option.
There you go.
Okay. And next we are going to change the extension. Now would be a good time to see if it's on there tight or how tight it is on. Sometimes you may need a set of pliers, so always have a set of pliers on you just in case. But in this case,
How would you do that? How would you use that if you needed to, if it was too tight? How would you do it?
So one side would be on here, the other side would be here. Press on it. You don't have to like grip it super tightly. You don't want to damage the lumen. And just, you know, just a light squeeze and turn it, and it should come right off. Okay, so this one you can see it's pretty loose. So now we are gonna get the saline, the extension, and the clave ready to change it out. So first what you want to do is you want to break the seal. So you could, one way you could do is you could just squeeze it like that and it'll break the seal. Take the plastic wrapping off. Okay, so now that is the seal is breaking, you could take out any air bubble. Okay, now we are going to grab the clave. So I like to go out this way, just like that. Get it on there nice. So you want to push it in, then twist it. And you want to make it sure like your hand is more closer to the end so you have better control of it. Don't grab it from here, grab it from here. Okay, and then we are gonna attach our extension onto here. So this side will go on this end. All right, and you want to prime out any air. Okay, so we got to drop out, loosen this guy up. All right. Okay, so we grab our alcohol, and we are gonna take this old extension off.
Make sure that that's clamped.
Yeah, and make sure it's clamped or else blood will come out. Okay, and then you want to...
What if they don't have a clamp?
If they don't have a...
You just kink it.
Yeah.
Because you want to close it. Make sure it's closed. Yeah.
Okay.
Some of them don't have a clamp on theirs.
But if they don't have a clamp, it doesn't really run out, right?
Yeah, but you always want to close that central line.
So if there is no clamp, you want to kind of kink it to prevent anything from leaking out. Okay, so we're scrubbing it for 20 seconds. I was getting there. Okay, 20 seconds has passed. Okay, so now we're going to get this guy, twist the tip off. Okay, then we are going to screw it on there nicely. Okay, now we can unclamp it. And then we're going to flush all of it, do the push, pause method. Okay, so let's just say for demonstration purposes, it's all flushed in, just so I don't get her shirt wet. So you could have, I'm going to grab the heparin, you could have pushed it here, or another method is if you don't want to push it, you can always just pull back on the syringe to release it. So it is a bit harder than the saline, so we're going to pull back. Take out any air.
How many mLs of heparin?
The heparin, for PICC line, the heparin should be 3 mLs of heparin. For adults, it's 100 units per ml. For pediatric patients, it's going to be 10 units per ml. For port, it should be 5 mLs total, 100 units. Or, same amount for if they're adult over a pediatric. Okay. Now we're going to flush it with heparin. We're going to take the saline off. Clean it for another 20 seconds. 20 seconds has passed by. Okay, then we...
And Jackie, I noticed that you didn't put a clave on at the end of that. You used no clave, just extension and no clave.
Yeah, and it's only going to be one extension. You only need the extension at the end of the line. Once in a while, you may run into a patient where there's a clave here, an extension, then another clave here. Did I say... Yeah, and that is not what you want to do. So this is the proper way is just to have one clave at the end of the extension. Okay, so now we're going to attach our heparin and flush it in. Push, pause. Clamp it. And then we are going to put on our swab cap.
I want to interject one more time. Because sometimes blood backs up, if you clamp as you're pushing the last bit of heparin in, it'll cause the positive pressure so that so there won't be any leak back flow of blood. It helps prevent that.
All right.
Okay, what about the other lumen?
Oh, other lumen. Okay. Are we adding extension? Or...
No.
Okay, so we're just changing the clave.
Mm-hmm.
Okay. Okay, so for this one, we're gonna change the clave again. Okay, so we'll make sure it's not too tight. It wasn't too tight, so it'll be easy to screw off.
And each lumen needs to be flushed.
Oh yeah, each lumen does need to be flushed daily with saline and heparin for maintenance wise.
And with each dressing change, you always change the clave. Each
Yeah,
clave.
yeah, and the claves and extension will be changed out with each weekly dressing change.
Okay.
Alright, so, okay, I pulled back. I'm gonna take out any air. I'm gonna grab the clave. It does tell you which side to be pulled out. There's an arrow pointing out which side to tear off. So I like to go like that. Then I like to grab it by the side that's sealed so you're not touching this end. Okay, push and twist. Okay, oh yeah, we're not doing the extension for this side, so make sure you flush out any air. So grab the alcohol swab, grab it here, and I like to secure this with my thumb and grab the lumen with these fingers, these two fingers, look like that. So pull it off. Okay, scrub for 20 seconds.
That was fast forward, 20 seconds.
Yes, yes. Okay, then you're gonna flush it, push pause method, all the saline in, clamp it, heparin, pull back, take out any air, so 1 drop is all you need. Okay, scrub it again. 20 seconds, scrub. Okay, then push it in, twist it on, unclamp. We're gonna push pause, flushing it all in. Okay, and then we'll get another swab cap. Okay, and just twist it on there. All right, and if we have a netting.
I don't have the netting.
Yeah, and some patients prefer to wear netting. Some don't care for the netting. But yeah, once we're done, we would just put it on, and that's it.
Great.
All right.